Ladies and gentlemen, welcome once again to another episode of the Think Clinical Podcast. My name is Hamza. Great to be here once again. Thank you so much for all you do for us. Today, let's talk about sales. Today, let's talk about one of the most uncomfortable conversations for healthcare entrepreneurs, sales. And let me start by sharing this statistic with you. Now, when you look at the 2023 study by the Healthcare Marketing Institute, the average healthcare practice converts only 37% of new patient consultations in treatment. That means 63% of people who showed enough interest to book an appointment walk away without starting care. If this statistic doesn't scare you, then I'm going to offer you more information that will help you put all this into perspective. And this actually means that if you own a practice and you are seeing 20 new patients or 20 new consultations monthly, that's 12 to 13 patients saying no. And if you have an average patient lifetime value of $3,000 to $5,000 in most practices, you are basically leaving $36,000 to $65,000 on the table every single month. Now, the problem here isn't your clinical skill, because you were trained very well and you are doing a great job at it. There's that nobody taught you how sales conversion works without feeling like you are used car salesman, because you were not trained to be a salesperson. The conversation we are going to have today is going to center around how do you actually reframe this and present the best value you can present for your patients without sounding like a salesperson. Because remember, your core responsibility is to help that patient. And if you are unable to present your situation in a way that affects the patient later on because they did not make a decision, in a way that makes the patient's condition worse in the future, then your moral standing around not wanting to sound like a salesperson is actually affecting this patient's health in the long term. Now, let's reframe this. Why does this feel so uncomfortable? Because, see, you went to healthcare school. We all went to medical school. And you went into healthcare to help people, not to sell them treatment, right? So the word sales on its own probably makes your skin crawl. Now, when you look at the research, and this research by Dr. Daniel Pinks, we found that 67% of healthcare professionals view sales as manipulative or pushy. 67%, that's almost 70% of the population. So 7 out of every 10 clinicians view this as manipulative and pushy. But in the same study, he revealed that 91% of patients, and this is 9 out of every 10 patients, who don't start treatment later regret the decision and experience the worst health outcomes. 91%. Just because you did not present the situation well to the patient, or because you had reservations about sounding like a used car salesperson. So now let me reframe this for you. Every patient who leaves your office without starting the needed treatment is a clinical failure. It's no longer a business failure. And we are not having a business conversation today. We are having a clinical conversation today, because every decision you make has a clinical impact on your patients. Now, let's look at this. Sales in healthcare, just to be clear, isn't about persuading somebody to buy something that they don't need. And it actually involves removing the barriers, preventing someone from accepting treatment they already know they need. Because these patients know they need this, they're helping them remove those barriers. Now, from research, what are these barriers? The highest or the top number one barrier to patients saying no to treatment that they know that they need is cost concerns. The commonest phrase you hear is, I can't afford this, right? What have you done to remove this barrier? The second one is always around priority confusion. This is not urgent for me. I have to travel for work. I have this family thing that I have to go take care of. I have Everything else is urgent apart from this. 44% of patients are in this category. The third category is decision anxiety, because look, you spend all of your day and your time in the hospital, you're used to the environment, you've seen all these decisions being made so many different times, but the patient walking up to you, you forget that they have anxiety. And 38% of these people always come in and they have anxiety about any decision that they make. 31% of patients who fall in the fourth category have trust gaps. I'm not sure this is the best solution. I need to get a second opinion. These are people who actually, they want to, but they don't trust you, or they don't trust what is being said to them. How do you help them cross this barrier? 27% of patients find the process overwhelming. I don't understand what happens next. Like, they don't get it because they have been bombarded all day with a lot of clinical jargon that they don't even understand what is happening anymore. So again, your job isn't to sell anything to anyone. Your job isn't to convince anybody. Your job is to address these barriers systematically. And that's not sales, that's patient advocacy. You are helping this patient who knows they have the problem which needs to be fixed. You are helping them cross these barriers that come up whenever they have to make that decision. Now, let's talk about the consultation structure, because most consultations fail because they lack structure. And you do a clinical examination, you present your findings, quote a price, wait for the patient to respond, and you think that is how you present a treatment to a patient. That's not consultation. That's basically a transaction, right? But the research actually showed that patient decision making need 4 psychological elements before they commit to a treatment. 1, they need to understand what you are presenting to them. They need to. Secondly, they need to believe, have some belief in what is being presented to them and where they are and who is presenting it to them. The third thing is that they have to be able to prioritize this, and the prioritization is important. They need to understand if it's an urgent thing that needs to be done. They need to understand how urgent this is supposed to be. And then the feasibility of it. These are the 4 elements that they go through. So in order to understand this, we'll look at a framework that I call the care consultation system, or care consultation framework. And the C, first of all, stands for connection. Again, I cannot emphasize this enough. Before you touch a patient or review a chart, you need to connect with them as a human being. Because if you do not, first of all, you are losing that patient already. And hey, look, you can always ask, what prompted you to come in today? And then what's important to you about getting this result? Have a decent conversation, build a relationship with the patient first. And that's what C is, that's connecting. The second one is A, which is access. You need to do a clinical examination, but you need to start narrating everything you're finding in real time. You say stuff like, I'm checking your gum tissue here, and I'm noticing some recession around tooth number 6. See how the gum line is higher here than the other side. That's allowing bacteria to get underneath. Can you see that? Involve the patient. Co-diagnose with the patient. Patients who visually see during assessment are 3.4 times more likely to move forward, according to research at the Journal of Dental Education. Use intraoral cameras. Show them their x-rays. Let them see what you see. That's the assessment. That's the A. I always recommend. This is where most providers blow it. They launch into clinical jargon about procedures instead of starting with outcomes. Now, this is the wrong way to do it. You need a crown on tooth number 19. You will prep the tooth, take an impression, place a temporary, and then you will come back 2 weeks for a permanent crown. It's $1,200. And this is the right way to say it. You are saying, here's what I recommend we do to protect the tooth so that you don't lose it and can keep chewing normally on both sides. I want to place a crown, which is essentially a protective cap that goes over your tooth. This will last 15 to 20 years typically and prevent the crack from spreading. The alternative is doing nothing, which means there is a 60 to 70% chance the crack worsens in the next 2 years and we need to extract the tooth. Does protecting your tooth make sense to you? So you notice the structure. You start with the outcome they want, explain the solution in simple terms, not with medical jargons, give time frames and success rates, and present the risk of inaction. Now, tell me this is sales. But I mean, there's no way that if you go through this, you don't go home feeling that you've actually advocated for your patient's needs. You can sleep at night knowing that they are not coming back to you in a couple of years with the worst condition that could have been prevented. And the E in the care is enable. This is where you handle the barriers. Don't wait for objections. Proactively address them. So if it's about cost, say the investment for this is $1,200. I know that's not nothing. Let me show you payment options that we have available and show it to them. You can pay in full now. We can take monthly payment plans. We have third-party financing. Show them what you're talking about and address these priorities. Like when a patient comes to you, and as I said, these are barriers that you need to be very conscious about addressing. If they tell you, look, this is my priority for me right now, say, I know you are busy, and this might not, you are proactively fixing these issues before they even come up as issues. And you might say, this might not feel urgent, since it's not painful yet. But here's what I've seen in my whatever years of practice. 7 out of 10 patients who wait on this end up with bigger problems that cost 2 to 3 times more to fix. And the best time to address this is now, while it's straightforward, right? You can address issues around anxiety. Does this feel like the right next step, or do you have any hesitation, right? Be proactive about how you help them address those barriers. And then you have to also be able to handle the need, I need to talk about it objection. Somebody will say, I need to think about it, I need to think about it. And it's really about thinking. It's code for I have a concern, I'm not comfortable voicing it out. So you have to be able to get this. Your response framework should always be around 1, you need to validate that concern. I completely understand this is an important decision. And the second step of this is now to isolate, just so I can better help you, because you're not going to allow what are you thinking about. You need to isolate what the issue is. So just so I can better help you, is it treatment plan itself you want to think about, or it's more about the timing of the investment, right? Most patients will reveal what the real concern there is. Okay, and then the third thing you do now is address it, because once they tell you what it is, if it's cost, you say, I appreciate you being upfront. Let's look at what we can do to work something out with you. If it's about timing, when would be a better time? What would be different then? And you have to get through that. And then you create a decision deadline. If you would like some time, that's fine. What I will say is that I'm seeing some active decay here, and waiting more than 4 to 6 weeks increases your risk of reaching the nerve. Could we schedule a follow-up call for next Thursday so I can answer your questions? This is how you handle some of these, I would like to think about it, conversations. Now, the price presentation. You have to be able to present the price in a way that makes sense. This is the wrong way. The wrong way to present this is, so for the treatment, it will be around 3,500, give or take. I know that's a lot. So if you need to think about it, that's totally fine. Nope. You have to say the investment for complete treatment is 3,500. That includes all 3 appointments, all materials, and our 5-year warranty. Most patients choose to split that into 12-month payments of $292, which makes it pretty manageable. What works best for you? Handling it at once or spreading it out? Now, you notice that in this presentation, there are no hedge words. I'm not saying things like around, give or take. I called it an investment, not a cost. I immediately offered payment options, and I gave them a choice between yes and yes, not yes and yes, not yes and no. Okay, so the anchoring effect here is that if you offer multiple treatment tiers, good, better, best, always present the premium option first. This is called price anchoring, and research from MIT showed it increased average sales by 27%. This is what you say. The comprehensive approach would be 8,500 and involves blah 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 blah. The moderate option is 5,200 and covers blah 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 blah. The basic approach is 3,500 and addresses blah 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 blah. Given that you have told me about your goals, I would recommend the moderate option because it gives you blah 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 outcome, right? Most will choose the middle, some will upgrade, but you are price anchoring this, okay? But not all patients, regardless of how you help them through these barriers, would say hey yes to the treatment. Again, everything we are talking about here is not selling patients what they need. They are giving patients the opportunity to get over the barriers that are preventing them from getting the kind of care that they need. So there should be a follow-up system for that patient who says, look, you know what, I need to just think about this. Let me go home and think about it. And you need to look at this because the research found that 67% of patients who didn't schedule at the time at the first visit would have moved forward with treatment if contacted within 48 hours. That's just the research. But only 22% of practices have any follow-up systems at all. So the 48-hour follow-up protocol, day one, that's the day of consultation, same day email. When the patient leaves, thank them, summarizing treatment plan with 2 to 3 key points. Second day, and include a video link to explaining their condition. Day 2, you text, hi Mr. Whatever, it's blah 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 practice, the blah blah from this practice. Just checking if you have any questions. If any questions came up about your treatment plan, and that's your second day, because the first day they got an email, second day they got a text, and then day 7, a phone call from you or your treatment coordinator. Hi, this is blah blah. I wanted to personally check in. Have you had a chance to think about the treatment we discussed? What questions can I answer? Right? This is very important. So you start with an email the day of, follow up with the text message the next business day, and then day 7, if there's no response, you follow up with a call. Okay. 30% of patients convert after the day 1 email. 25% convert after the day 2 text. 12% convert after day 7. So you do realize that the chances of you converting these patients keeps dropping, right? So this sets the 7% you lost patients recovery within a simple 3-touch system. This is very important, and this also